Hey everyone. Over the years, working with hundreds of fertility patients and single parents, couples who are trying to conceive, there's been a very cornerstone treatment avenue that I found has made a huge impact on practice and seeing these patients succeed in their dreams of starting a family and having a child. And it's a treatment avenue that has been gaining momentum over the last, I would say, 3-4 years in research, and seems to have an impact on all levels of fertility and beyond. So what I mean by that is it seems to impact potentially fertility rates, significantly has been associated with miscarriage rates, and has also been more recently associated with the health of the offspring. So when we're looking at this particular test parameter, if it's unhealthy, we see that the offspring may actually have an increased risk of certain health conditions, serious health conditions, and that if this health parameter is good, the offspring may actually have a reduced risk of these health conditions as well. So what is this new treatment avenue? And I say it's new, but we've been doing it for a few years now and have seen it impact patients who had unexplained infertility, patients who are working with low embryo quality or low egg quality, patients who have recurrent miscarriages, and patients who have partners who have been diagnosed with a condition such as PCOS or endometriosis and are wondering what else can be impacting their potential outcomes. And so this, what I'm talking about today, is something that you might be familiar with. We've talked about it quite a bit through over the years in our research posts here, and it's sperm DNA fragmentation rate. So sperm DNA fragmentation rate, just to explain a little bit, refers to single strand or double strand breaks in the DNA structure of the DNA or the chromosome in the sperm cell. And sperm cells are incredibly sensitive. So sperm cells during the maturation process actually have a lot of the cytoplasm, so the fluid inside of the cell removed. And when that fluid is removed, we actually remove a lot of the antioxidants as well. So sperm cells become very sensitive to something called the reactive oxygen species or oxidative stress. So if we have high amounts of oxidative stress in the body, sperm cells are very susceptible to that damage, and those reactive oxygen species have an imbalanced electron state, so they're looking for electrons to help balance their charge, and as a result will take an electron off some of the DNA, and that will lead to these double strand or single strand breaks. And so I usually like to describe it as what we call hairline fractures. So all the chromosomes are there, it's not a chromosomal or genetic abnormality, but instead we start to see that DNA structure has these hairline fractures, and it's referred to as poor DNA integrity of that chromosome. And so what we've seen is if this DNA fragmentation rate is high, it may significantly impact pregnancy rates. And if it's high, it's been very well established that the miscarriage rates for these couples are much higher than usual as well. And the health of the offspring may be impacted as well. So there's a lot of correlation between elevated DNA fragmentation rates from the sperm cells and an increased risk of certain health conditions. Some that have been correlated with this are congenital heart malformations, lung malformations, cleft lip, autism, schizophrenia, and certain childhood cancers as well. So when we're talking about this, we're talking about fertility, but also beyond fertility, and helping couples potentially conceive a child that has its best shot at a healthy life. And what I love talking about this so much, because there was a wonderful systematic review and meta-analysis published in South Korea a couple of years back, or 3 years back. I keep forgetting we're in 2021 now. And they basically looked at how do we treat DNA fragmentation rates for patients. And their conclusion was that the best way to treat DNA fragmentation really comes down to lifestyle, dietary changes, and different micronutrients, which can help to compensate for elevated oxidative stress. So we reduce this impact of oxidative stress on these vulnerable and susceptible sperm cells to help protect and preserve the DNA integrity. And so this is something that's been, I think, a cornerstone for our treatment approach for many patients, from all walks, patients who have are just trying to go for IUIs, patients who've been diagnosed with unexplained infertility, or patients who've had recurrent miscarriages or implantation failure. And we look at, to what degree is, this a factor, a uterine factor or an ovarian or follicular factor, and to what degree may potentially that should be a sperm factor. And more often than not, I feel like this is a area that has not been touched on very profoundly or thoroughly when it comes to treatment options, because usually patients will get like the basic sperm analysis done, which will check for sperm concentration, sperm motility, and that's about it. And then, if those numbers are good, usually patients feel like, okay, everything's good, excellent, sperm health, nothing more to do, which is now, we're realizing over the years is actually a very primitive understanding of sperm function and sperm health. And we have these newer tests that are called advanced sperm function tests that actually provide a lot more insight into if that sperm cell is able to fertilize and whether or not the sperm cell has this DNA issue or not. And we shouldn't be totally dependent on the test either. One of the issues that we're running into, the research has highlighted quite frequently over the years, is that there's currently about 5 different assays that are used to help determine sperm DNA fragmentation rate, and the issue is that none of them are perfect. They all have some room for error. So when we work with a couple that we suspect this is an issue, but it shows up normal on the test, based on the literature, a lot of research studies and researchers are now recommending that if we're seeing that a couple is having a recurrent failed IVF, if they're having recurrent miscarriages, but we're seeing the DNA fragmentation is actually okay, then it may actually be still worthwhile treating it, especially because the side effect profile is so low and the safety profile is so high for this treatment. In fact, there was a very large research paper published in 2019 in March, and what they found was that if patients took a lot of these micronutrients and antioxidants for 3 months before their IVF, they were almost 3 times more likely to get pregnant compared to couples that didn't use these micronutrients for the sperm health. And that the live birth rate, so how many of those patients went forward to actually give birth to a healthy child, was almost a double compared to patients that didn't use this treatment parameter. So this isn't something, we want to just openly give to everyone, but it is something that deserves a discussion beyond just, hey, sperm motility and sperm concentration are good, so there's nothing else wrong, which can be misleading and I think leads to a lot of frustration for a lot of these patients that, as soon as they start the treatment protocol and the micronutrients, the lifestyle and the dietary change, all of a sudden they get pregnant after months or, a couple of years of trying unsuccessfully. It becomes a, very incredible and rewarding a moment, but also eye-opening to how important the impact of sperm fertility and the responsibility your partner has on taking care of their health and doing their part, their preconception and prenatal work to really help support fertility outcomes. So if you have any questions, drop us a message or send us a direct message or email, and we're always happy to answer questions you may have.